Hello, I'm Dr. Gareth McDonald, chiropractic physician, Eugene's auto injury expert at Cascade Health Center. Today I wanted to talk to you about nutrition for the brain. And before I go on, I want to say that none of this information that I present is meant for medical advice to you in your specific condition. It is simply that, information, something for you to think about, and something for you to share with your medical provider if you wish to take advantage of this information. All right, let's get started. What I want to first talk to you about is, what is the brain? Well, the brain is an organ. It's made up of cells and made up of receptors. And the brain has the following structures. Now, don't get hung up on the words, just know that these structures exist. And they are the microglia, the astrocytes, the blood-brain barrier, and neurons. I want you to think of creating the optimal environment for this remarkable organ. I want you to try to avoid thinking of diagnostic labels. I prefer you to think of in terms of global function rather than a diagnostic label. I'd rather focus on the understanding of the brain's neurophysiology within the perspective of global function in general and some of the nutrients in particular. As physicians, we are taught that a patient presents with symptoms, we then figure out a diagnosis, and then we provide the treatment. What I'd like you to do is to think of the brain as a remarkable self-organizing and self-repairing organ that adapts quickly to its environment. Imagine yourself for a second as a nutrient, either in a food or already ingested in your tummy. Now imagine the brain wanting to function optimally. That is, the neurons, the glia, and the astrocytes all reaching out to receive you, the nutrient, to partner together in its harmonious function. Now imagine something going wrong in that system. Imagine in some way the nutrients are not arriving. They're not being valued for the benefit it can bring. So imagine the results. There would be impaired function, a depression of activity, and eventual secondary psychological consequences. And as a result of these impairments, you would get a diagnosis. And as a result of that diagnosis, there would be the addition of powerful chemical substances. Sometimes you're given just one, but many times you're given them in combination. And as a result of that, we end up with drug side effects. Basically, your life, your health, your brain. Our goal should be to optimize brain function rather than to name, blame, and tame the disease. A conversation typically goes like this: "Doctor, I feel down all the time." And the doctor responds, "Sounds like you're depressed." And the patient then says, "Why do I feel so depressed all the time?" And the doctor responds, "Because you have depression." Patient says, "Well, what's the best treatment for me then, doctor?" Doctor says, "We will prescribe you antidepressant medications. And these antidepressant medications may make you feel suicidal or have lethal side effects or cause you to feel fatigued or completely asexual. But you need to take them." This is typically how the conversation goes. However, the brain responds in a myriad of specific, but often and most commonly non-specific ways to a combination of nutrient imbalances, glial astrocyte activation, psychosocial influences, environmental toxins, and drug exposures. Instead of asking, well, what is the diagnosis? And then obviously, what is the drug? The question should be, how can we make this brain work better? This question would be answered by asking, what are the basic needs for the brain to function properly? And once we figure that out, let's provide these. And the other question would be, what insults impair our neurocognitive or psycho-emotional health? And therefore, let's avoid these. So we need to come up with some kind of major intervention for brain health to equal optimal function for the brain. And the three basic steps would be psychological interventions, avoidance and clearance of toxins and infections, and complete nutrition. These major interventions would include a diet change, vitamins, minerals, essential fatty acids, botanicals, and additional interventions such as including hormones, especially thyroid hormone, in an active form. The solution would be a 5-part nutritional protocol. Step number 1 would be a Paleo-Mediterranean style diet, which would include fruits, vegetables, nuts and seeds, berries, high-quality proteins, and allergy avoidance. Number 2 would be a multivitamin and a multimineral. You definitely want to make sure this is a high-potency, broad-spectrum multivitamin, multimineral. Number 3 would be vitamin D supplementation. The minimum would be at 2,000 international units per day and as much as 10,000 international units per day, probably in around the 5,000 international units per day, to optimize serum levels. The best way to do that is to have your blood levels checked before you start taking your medication, and then once you've started taking enough vitamin D, have it checked again to make sure that you've reached the optimal levels. Number 4 would be combination essential fatty acid therapy. This would include alpha-linoleic acid, flax, walnut, and hemp oil, and gamma-linoleic acid, which would be an example of borage or primrose oil, EPA and DHA, which would be your fish oils, and oleic acid. And number 5 would be probiotics, especially if you have any allergies, irritable bowel syndromes, and you've ever taken antibiotics at any point in your life. These would be the 5 steps that one would need for optimal brain function. Thank you and enjoy the information.